Welcome back. We're on the record with the Lieutenant Governor. Let's talk about Stewart Healthcare and the crisis that led to the closure of two regional hospitals, Kearney and Neshoba Valley. I always call it the Kearney. I know this is what I've done my whole life. But the license for Norwood Hospital, which was being rebuilt, has expired. So what's the future of the Norwood Hospital?
I mean, I tell you that we are really focused on trying to save the 6 hospitals that we did and working on the 2 that were closed, both in Neshoba and the Kearney, as you say. And I know there's a team working on Norwood as well. That hospital was not closed as a result of this Stewardess situation. It has been closed for a number of years because of some flooding that occurred on that site. Correct. So I will just say, like, obviously a year ago we were in a much different place with Steward in bankruptcy, not able to make payroll, real turmoil for both patients, for healthcare workers. And I'm really proud of our team who have worked tirelessly over the last several months to ensure that we were able to save 6 of those 8 hospitals, new providers, some transitions going on there, but really with an eye towards protecting patients, protecting healthcare workers. And this is inextricably linked to our economy in these regions as well. So ensuring we've got a strong footprint moving forward is key.
The CEO of UMass Memorial Health believes that more hospital closures may come. He says state law favors larger hospital systems over smaller ones. A, is he wrong? And B, is change needed?
Well, I think the healthcare model right now is going through some transitions post-COVID. It's a different sort of environment in terms of funding needs, workforce challenges. So transitions are happening in healthcare all the time.
Does the legislature need to act here?
We didn't have a lot of telehealth before. Now we do. Right. There's opportunities for more mobile integrated health.
Pandemic, right?
I think some
essentially,
of that, definitely some of that is
true.
But
the legislature didn't act this past year on this. Should they act?
Well, I think that we need to get a convening together, and that is underway already, to think about how do we address we are number one when it comes to healthcare. The best high quality healthcare institutions in the country exist right here. How do we ensure we keep the high quality healthcare, have folks that are sustainable, both on healthcare, hospitals, workforce, health insurers? We've got work to do, but the smartest people in the world exist right here in Massachusetts to tackle this challenge.
Earlier this year, your administration announced that you had secured federal funding to go toward replacing one of the Cape Cod bridges, the Sagamore Bridge. The state has had unsuccessful applications for grants, however, for the Bourne Bridge. So what is the plan now moving forward for the Bourne Bridge?
Well, we're seeing this more as a phased project, and these are 2 significantly large infrastructure projects.
And you did just get a big grant for the Sagamore.
We should be clear. We set up a federal funds office. We are going after every federal dollar we can. We have historic amounts of federal funding available to both cities and towns directly and to the state. Thus far, we've brought in over $8 billion in federal funding. We are leading the nation. We're in the top tier of states bringing back resources.
You're just going to keep on applying.
And we're going to keep applying and recognizing that when you have large projects, sometimes you've got to break them up into component pieces. And not only in infrastructure, for a state that's nearly 400 years old, we've got a lot of needs, and we're going after dollars. We just brought back another $37 million for West East Rail. That is now close to $150 million for West East Rail. We've got the Alston multimodal projects. These are big, significant, transformational infrastructure projects that we've been leading on and will continue to, with the help of Washington. Another reason to make sure we've got Kamala Harris elected, sitting in that White House, helping partner with states on the needs that they have most.
Well, as everyone knows, you were the mayor of Salem. You still live in Salem, right?
I do.
So the wildfires are in Salem and in other communities as well, not just Salem. They're really having an impact. All of a sudden, we've become California in that regard, right?
You know, we just haven't had enough rain. I was on site on Sunday when we had just an amazing regional response helping address some of the wildfires in Salem, that we're getting closer to where people are living. And so I just want to thank all the crews that were out there. We had state level crews, we had regional crews in response. These fires are hard to fight because they're off in the woods far away, which makes it difficult getting materials back there. We had 50 Bambi bucket drops to try and tackle some of this. The reality is we need people to be really careful and cautious with how they're using the power that they have, whether it's camping or burning leaves or things like that, when it's so dry, because it has a big impact on where people are living. And
it's
the smoke was really rough in terms of closing daycares and impacting the way people can breathe.
And not that misery loves company, but I was driving on Route 9 the other day in Brookline and I could smell it.
Yeah, I mean, depending on when the wind shifts, it can really make a meaningful impact in a much larger region. So all the more reason for us to have care and caution, listen to those public safety officials.
Thanks for your time. Great to see you.
Thanks for being here.
Our thanks again to Lieutenant Governor for sitting in the chair. The Sunday Roundtable is next. Lots of trash talk in the closing days of the presidential campaign. So who will clean up on Election Day? Lots to discuss. Let's do it.